This is Dr. Cliff Gruntseth coming to you with another Dr. Cliff's Riffs. Today we're going to be talking about AI in medicine. It is a wind that is blowing through the land that we will try to give an overview, a 10,000-foot view of what doctors in the trenches are feeling about it and maybe what's coming down the pike for you. The ability to make predictions is very hard, especially about the future. My favorite quote from Yogi Berra. But I think what we can try to do is try to get behind this hidden door and just take a peek to see what may be coming down the pike. As we talked about in the past, healthcare system is very, very complicated. A lot of parts associated with it, the medical training, pharmaceuticals, hospital systems, government, and it's, as you know, in the United States, is quite fragmented. We really don't work together for a common general populace good. We're fairly regional and local in our healthcare, and even right down to personal sometimes in the office. And healthcare moves kind of slowly. The technology is oftentimes not immediately adopted, especially when it comes to technology. And so there's a little bit more cautious air about this AI business. My view of it is, in a quick summary, it's carbon versus silicon. If you look at the periodic chart in the chemistry class, you'll see the carbon is a 4-valent atom. Silicon is also a 4-valent atom right below it. Carbon represents humans. Silicon represents chips and technology. And there's a war going on between carbon and silicon. Silicon is very rigid. If it doesn't fit the rules of the process, it doesn't work. And sometimes you have to just restart and try again. Carbon is somewhat predictable, but not always. And sometimes it's completely irrational. It's not a logos or logic. It has a lot more pathos and ethos that gets involved with the decision making and the behavior. And because of this conflict right now between this hard-coded silicon and the kind of irrational, emotional carbon, healthcare bridges those two lands. And so we'll see where we end up. In today's society, as you know, we're just getting inundated with data, and it's not stopping. It's just exponentially rising. It becomes a kind of cognitive overload for physicians, especially because it's just so much information that we have to understand. There's new reports coming out, new standards, new techniques, and we're supposed to kind of process all that, know it all, know everything about healthcare, and it's really, at this time, not possible. In comes AI, and this is the promised land for knowledge. As you know, there's been major technological breakthroughs that have changed society. The internet has, about 20 years ago, really changed things. The cell phone has made people's lives much more personalized and connected, and also impersonalized based on the social media. And now there's a new revolution, which is this AI, which may supplant humans. Now, the AI has 3 main phases or types. There was the original kind of fixed, rigid AI, which allowed you to prescribe medications, but if it was written wrong, it would flag the system and say, no, insulin is prescribed in this dose, not in a mega dose. That was a typo. And that was, in a sense, good, because it caught errors that may have caused catastrophic problems. And now they're starting to process and synthesize the collective data and see if there is a certain pattern going on that might indicate a disease process or some other type of medical situation which can be caught early. And now there's predictive AI. That's the big challenge is, can the data collection actually anticipate and predict better than physicians or clinicians? And there's been some studies to suggest that AI alone is actually better than a physician using AI. Now that data is, is one or two studies, but it may be that with all of the data that's coming through our system, it may be that AI is just going to be a superhuman type of knowledge base. But like we talked about, AI is rigid and it doesn't have the human emotional component. So right now, healthcare is just putting its toe in the water with AI. You'll have it you'll see it around. And if you haven't already used ChatGPT to look up your disease or your problem to see what it has to say, it is inevitable. The AI does have a role for getting rid of some of the office logistics, some of this overhead burden that we face every day between the billing and the scheduling and just the processing of running systems. And the nice thing about AI is that it's starting to take kind of disparate data and it's starting to aggregate it into a somewhat of a channel so it can see trends and perhaps see trends earlier than random dots that we might otherwise experience as clinicians, taking hundreds of thousands of patients with millions of data points. May be able to predict or aggregate certain conclusions based on the pattern of the situation. Physicians are overloaded with data. There's so much data coming in that it's sometimes hard to even process, and most forward-thinking providers do use the internet and AI to just help discern, are there drug interactions of these 10 drugs, and what does the research show as far as validity. But the problem is it's not always truthful. It's hard to know what is real and what isn't. The note writing is, as I mentioned, a big burden for clinicians, and now they're starting to have this ambient listening software. So in the background, the conversation of the provider or the clinician with the patient is aggregated, processed, summarized, and it may generate a report. It's not that accurate. We've tried it. It is still inaccurate, and so it almost takes more time because you have to read every transcript, and sometimes it's easier for us to simply dictate the note. And even dictation is not correct because errors happen with the dictation system. But there is value in having an individual's data point kind of compared to a population aggregate of data to see if there are certain patterns or trends that may develop. The issue is that there's a risk involved with medicine. There's low risk and there's high risk issues. If you're prescribing glasses, it's not a high risk situation. You'll know that if the prescription is not correct, that you can always get a new one. If you're getting surgery, however, then that's a whole different game. Then now you've got this very high stakes, high risk situation. So it really depends on where on the risk curve you're applying this artificial intelligence to use inside of clinical care. And like we talked about, there's hallucinations. The way AI works is fairly complicated, but it's basically chewing and chewing and chewing data, regurgitating on itself, and it puts out what it thinks is the correct pattern of things based on probabilities and weights and the data that it's trained on, etc. And what data it trains it determines what the outcome is. You've probably read about that in the news. There's still a need for a human in the loop concept where even if the AI does generate some type of suggestion or conclusion, that it needs to be reviewed by somebody that likely knows what's going on. There is a concern about kind of cognitive loss or dumbing down as we offload some of the information and decision making and the knowledge as the training may change. It's not sure, they're not sure if that's a true fact, if the AI will actually enhance knowledge and experience and clinical acumen simply because it now has more data to make a decision. It can accept or deny the suggestion by the AI. However, the future will likely be how well you can manage and interact with the AI. Prompt engineering, as you've probably heard of that term, basically is how to phrase a question for the answer that you desire. And, garbage in, garbage out, or the opposite. If you have a good input that explains the situation, including data points, it may be able to generate a much more coherent and a fairly accurate and comprehensive recommendation. There's also talk of software as a medical device. You have it on your phone, you have watches and different devices that record your sleep patterns and your heart rate, etc. And that will become more and more integrated into the system. It brings more data into the system, into the clinical decision making, but the software can, in theory, process that and determine, what is a trend, what is dangerous, what is not, and maybe flag it. And for now, the human will make the decision. In the future, I'm not sure. The biggest question is, where are the guardrails for this technology? Where the government may have to step in and decide when AI is allowed, when it's not. Right now, it's the Wild West. People are using it, but with a caveat. The future will likely be that you will have this personalized data set that is personalized medicine, which allows you as a unique individual to be able to be assessed both digitally and by a provider, a clinician, to assess what is the best approach moving forward. And I imagine that this will be the doctor of the future, where they have this data that is AI supported, AI assistant. There's three things in the room now: the patient, the clinician, and this computer. That is the talk of the future of healthcare with AI, but there still will need to be that pathos and ethos of person-to-person interaction, at least in the short term, for healthcare. Eventually, it may be that the healthcare and providers simply fall off the waterfall, fall off the cliff into the abyss, don't know where they're going to land. There is major concern among the medical community about superhuman computing power replacing providers. But again, the idea of having somebody that knows you, that can actually understand the empathy and the situation that you're in. It's not just a physical data set, but actually the emotional side of it and the psychosocial part of medicine, which will take a long time to replace. even if there are mental health software programs that profess to be counselors. That is a long, long way away. So the bottom line is that it comes down to trust. And right now, AI may be a useful tool. You will see it incorporated into the healthcare system in your visits, perhaps with chatbots or the physician getting cues from the electronic health record, etc. But ultimately, it's going to come down to human interaction. Hope that's helpful for you, just to get an overview of the physician's perspective.